My name is Dr. Laurie Keefer. I'm a health psychologist specializing in gastrointestinal diseases, particularly inflammatory bowel disease. And I am a professor of medicine and psychiatry at the Icahn School of Medicine at Mount Sinai. And today I wanted to talk a little bit as we kind of go into the holiday season and as we kind of come out of, hopefully, a pandemic. I wanted to talk about learned optimism. Optimists tend to view adversity in their lives as temporary, as limited in their scope, so not all-encompassing, and something that they can manage. Optimism is actually an explanatory style, so a lot of times we think about patients who are half glass empty, half glass full, but you can actually learn to be more optimistic. And the reason to do that is because optimistic people tend to have better health outcomes. So this is very important when we're talking about patients with Crohn's and colitis, patients with irritable bowel syndrome, or other chronic conditions. Optimists tend to be less stressed, less depressed than their counterparts. They're more likely to experience positive healthcare system interactions, and they often tend to recover quicker from cardiac events, stroke, cancer. In fact, optimism has been associated with longevity and better cardiovascular health. There are some important tips that I'd like to just share in terms of how you can kind of go about the holiday season as an optimist. So my point is that I'd like you to choose optimism by shifting your perspective during tough times. So one way to do that is through the 3 Ps. First, permanence. So if we think about bad things as being temporary or changeable, it's a lot easier to manage them. So for example, during the COVID pandemic, we haven't been seeing people and we're feeling sort of low about that. But one way to think about it would be that once we get that vaccine for SARS-CoV-2, we will see each other again. Or if you're dealing with a chronic health condition, once that medication starts to work, I'll be able to enjoy vacation again. The second part of the 3 Ps is pervasiveness. So here we want to sort of choose to not let one bad experience bleed into other bad experiences. So for example, because you're furloughed from work doesn't have to also mean that you're not a good parent. Having a bowel accident on the subway doesn't mean that you're a disgusting person. We try to just keep experiences to what they are, to understand them as they happened, and not let them bleed into all aspects of our life. And then finally, the last of the 3 Ps, permanent, pervasive, is personal. So personalizing is something that we often tend to do when bad things happen and make us feel even worse. So we want to be careful about taking on too much blame or responsibility for things that are really outside of our control. So, for example, not being able to find a new job during a pandemic isn't necessarily a sign that you're personally not qualified or don't have a good work ethic. Same thing with being diagnosed with Crohn's or ulcerative colitis. It doesn't mean that you did something to cause it, you did something wrong, you got too stressed out, or you didn't eat healthy enough. Rather, it's something outside of your control that you don't have to attribute to your own personal character. So I would encourage all of you to really take home this point in November, to start to focus on choosing optimism, practicing gratitude, and rebuilding social connections that have maybe taken a hit during the pandemic. Looking forward to 2021.